Hello, my name is Dr. Courtney Bladson. I am the Director of Clinical and Quality Improvement at the National Healthcare for the Homeless Council. I am thrilled to invite you all to join us for an upcoming webinar series titled Homeless in the ED, Partnerships to Improve Care for People Without Homes in the Emergency Department. This topic is near and dear to my heart. I spent the first 7 years of my medical career working in the emergency department. And for anyone who's ever worked in the ED, you know that the ER is a reflection of all of the holes in our social safety net, whether that's our current overdose crisis and lack of access to substance use treatment. Folks flood the emergency department for care. We see in our current pandemic where folks have nowhere to go and people can't access treatment, they go to the emergency department. We know that the same is true for people experiencing homelessness. When they're not able to access care at the end of the day, they show up in the emergency department. We here at the council want to partner with our colleagues in the emergency department and bring together our healthcare for the homeless community to better care for people experiencing homelessness. And I hope you join us. We here at the council, we work to improve healthcare throughout training and technical assistance, research, and sharing best practices. We advocate for solutions to end homelessness and uplift voices of people experiencing homelessness. Grounded in human rights and social justice, the National Healthcare for the Homeless Council's mission is to build an equitable, high-quality healthcare system through training, research, and advocacy in the movement to end homelessness. Feel free to join us on our website. We have so many ways to engage, whether it's through advocacy, there's many educational opportunities. We have many ongoing learning collaboratives and webinars. So check out our website for more. Here are some of the numerous challenges facing the emergency department right now. We know that people experiencing homelessness are high utilizers of emergency services. That is borne out in so much evidence and data and research studies. We know that emergency department staff receive very little training on how to care for people experiencing homelessness, specifically supporting folks with complex medical conditions with a combination of mental health and substance use. Often people experiencing homelessness have high rates of trauma. And so really trauma-informed care is something that should be a standard, but there's very little training in the ED on trauma-informed care. The role of the emergency department is to treat acute medical needs and not to address systemic issues like homelessness. It's really important for us to not overburden emergency departments. We want to make sure that there is space, that there are beds for people who have heart attacks, strokes, those who get in car accidents. We want to make sure that people's needs are being met in appropriate settings. People experiencing homelessness have high barriers to primary care. One of the ways to articulate this is when you do not have a secure roof over your head, when you have many competing priorities. If someone needs to get in line to get into the shelter for the night, and that's the same time that a primary care appointment was scheduled, folks are going to have to prioritize that higher need of shelter for that night. When you have to get in line for a soup kitchen, when you're just trying to get your basic needs met, it's really difficult to prioritize your health. And so what happens is even if you feel unwell, it takes until a crisis, until something is so dire that you end up in the emergency department. So it's not that people experiencing homelessness don't prioritize primary care, it's that whether it's transportation or other competing social needs, it gets put on the back burner until something is a crisis. People experiencing homelessness have complex needs. They have higher acuity, higher disease burden, higher burden of illness, as well as disproportionately high rates of both mental health and substance use disorders. So all of this adds together to create very complex needs when these clients show up in the emergency department. And number 6, finally, we all know who work in healthcare that there's a lack of coordination of care. Our healthcare systems exist in silos, whether that's acute care and hospital level care and primary care. Often they're very disconnected. And for folks that are this complex, that have this much social need, it's really important for us to start to build these bridges between our health systems to prevent some of the recidivism, but also provide higher quality care for people experiencing homelessness. We all want patients to be seen in the most appropriate setting and have their needs met. Connecting them to that setting and coordinating the care is key. So we often hear, and the research support this, that people experiencing homelessness have very traumatizing events while they're in the ER. They'll often go with a priority, whether that's a headache or back pain. But while presenting for a headache, they may have extraordinarily high blood pressure and might be having a mental health crisis. And so what they're perceiving as a priority with their headache, someone is talking to them about blood pressure and someone's talking to them about their mental health. And so you often feel unseen and unheard. And that can be exceptionally frustrating. But for the emergency department staff, they are treating the most pressing medical need in that moment. And so that's where we want to make sure that folks are getting their acute care needs met within the emergency department, but then getting connected to primary care, and specifically at our health centers, our healthcare for the homeless at health centers, where they have multidisciplinary teams that are ready and prepared and well-trained to support this complex population. So we really want to put in that missing piece, that care coordination to bridge. And this is what we're working towards. We want to build a continuum of healthcare. We know that clients don't walk through this specifically straight through from hospitals to medical respite to health centers and eventually into housing. We know that this experience of healthcare is very fluid for people experiencing homelessness. But what we want is, regardless of the setting, wherever someone is sleeping, we want them to receive high quality healthcare. We want that care to be coordinated and not redundant. And here's our lineup. I hope you join us March 16th. We're focusing on homelessness and emergency department care. We are honored to have our guest, Dr. Iguandanos, an emergency physician based in Seattle. He is the CEO of Community-Based Coordination Solutions, and Dr. David Munson, an internal medicine physician at Boston Healthcare for the Homeless Program. And they're going to talk to us about this unique population and how to best care for them in the emergency department, and really working on connecting to social services and connecting people to meet that social need outpatient. March 23, the next week, we're going to dig into harm reduction in the emergency department. How do we meet people where they are in the moment, reduce harm around their substance use, and really use that small window of opportunity when they're in the ER to try to connect them to substance use treatment outpatient. And then finally, March 30th, we're going to work on discharge planning and really trying to prevent that revolving door in the ER, and how we can leverage medical respite care as one model for doing so. So please join us. We really are hoping to get all of our emergency department colleagues and our healthcare for the homeless community together to have this conversation, to dream up and to build this better system together. So will you join me? I look forward to it. Hope you have a wonderful day. Bye.